MLTs and MMTs for the knee. There are a few of them that are mentioned, particularly for the TFL, the quads, and the hamstrings, but we kind of already went over this test in another video, which are the Thomas test and the straight leg raise. So the only other one is the ankle plantar flexion test. So with this, I'm gonna have Angels lie on his back. We're going to test the 2-joint plantar flexors first, which would be the gastroc. Straighten his leg. And then I'm going to kind of just cup his calcaneus and use my forearm to kind of put him into a stretch. So we're just going to get this right here, and then we kind of go back. You feel a stretch, okay? Okay, where do you feel that? Okay. He's got about neutral, maybe about a couple degrees above that for dorsiflexion. And of course, do the other side. And then for the soleus, it's kind of different. So you're going to have them go into prone. And just a word of warning for this one, you kind of have to get a little bit of force to it. So first, it suggests that you find subtalar neutral, so you can if you want to. We apply some pressure at the calcaneus and metatarsal heads to bring the foot into dorsiflexion. So kind of like that, kind of like a little lumbrical grip around there. And then meanwhile, with the other hand, you're going to push into that first bit of resistance, and you might have to push a little bit hard to get him to feel some sort of stretch, and then you take your measurement with a goni after that. So we're going to do this, and then we're going to do this. MLT, yeah. Okay, where do you feel that? Okay, so yeah, as you can kind of see, you kind of have to give a little bit of energy into this. But then you take your measurement, or you can just kind of eyeball it and compare it to the other side. Okay, next we have the MMTs for the knee. Don't think this should be too particularly difficult. Maybe they will, maybe they won't, I don't know. So we have a couple of different muscle groups. First are the hamstrings, which we already tested in the other video, so medial and lateral. The hip flexors as a group, the TFL, which, by the way, if you saw the TFL MMT for the hip, make sure the only thing I didn't do was put the patient into internal rotation, so make sure you do that. But everything else as far as the direction of the force should be correct. Then next you have the adductors and the sartorius, the quads. So we're going to test the quads real quick. You mind or go and sit up here on the end of the table. Oops, sorry, that's good. So what I'm going to do is I'm going to test the side that's closest to me. Actually, go and bring both legs. Yeah, because what I'm going to do is I'm going to kind of create a wedge for under his close knee and use this hand to stabilize the other one so that he doesn't use it during the testing. So I'm just going to say, okay, here's what I'm going to have you do. You're going to straighten your leg up here and come back down. Can you do that? Okay, very good. I want you to do that again. Now I want you to bring it down a little bit into slight flexion. I want you to hold this position 20 degrees of knee flexion and try to breathe. Don't let me move you. It's pretty damn strong with his quads. Okay. And do the other side. And then lastly, we have the gastroc and the popliteus. So we'll do the popliteus first. Pay attention, guys, because I'm not going to do it again. Can you bring your toes into in this way? You do it again?
Start next turn.
Right, so start next turn rotation. Do it again. There you go. Popliteus. Next is gastroc. So you're gonna stand up. So this is the calf raise test. So in order to grade the test, if they can do 20, they get a 5. If they do 10 to 19, they get a 4. If they do 1 to 9, they get a 3. If they can barely clear the heel from the ground, you'd probably say 2+, but you can always test it in gravity eliminated as well. All right, so what you can do to make sure that they're not compensating is you as a therapist can do this. They can place their forearms over and you kind of feel if they're putting too much pressure in or if they're kind of all over the place. So we're gonna test the unaffected first. So let's say your right was affected, we're gonna test the left first. You stand on your left and you're just gonna go all the way up on the balls of your foot and down. Good. And you kind of count how many he does. So he did 20, he's fine.